What up, fellas? It's time. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watched the video, maybe even liked and subscribed, I appreciate you. I really do. And welcome back. So today I want to talk to you about CFR, or cancer related fatigue. If you've been in our community long enough, you'll know that one of my earliest videos was about me being extremely fatigued. After my radical prostatectomy, there was a point one time where I was on the couch. I just could not get off the couch. It was very difficult. I felt like there were hands on top of me and I just could not get up. And so I went over to my doctor and we talked about some things and that we could come up with that, would give me some additional energy. But I want to do a deeper dive into that today because I want to talk to you a little bit about this cancer-related fatigue, because I walked into a cancer center and I actually saw one of these magazines and it had it on front, and I was like, I don't normally see these when I go to my doctor's office. But when I picked it up, I was amazed to see that men who have had prostate cancer are more apt to have cancer-related fatigue, or CFR. And there are a number of reasons that could happen. So I wanted to talk to you about it because some of you may be going through this and you may not be aware that that's what that is. So let's talk about it. So whatever your treatment option is, or whatever it is that you've done, if you've had prostate cancer, you may face a loss of energy. Now, there are some people that have been blessed that don't necessarily have that. But in my particular case, I got it. I was tired. And I was reading through the comments and, I see that some of you have watched the videos and you've gone to the doctor and you've tried to get your doctor on board with understanding that you and he need to come up with a plan like my doctor and I did. And in some of the comments, I saw that your doctor didn't seem as concerned. I want to make sure that I give you what it is that I did, and maybe if you use it, it'll help you. So when I went to my doctor's office, I was very clear that I didn't want to use the word tired. So what it is that we have is more than being tired. It is extreme exhaustion that's way past that. It's something that if you go get some rest, it's not fixed. You're still feeling the exact same low level of energy. And that is what I wanted to make sure that you did, because for doctors, the prescription for tired equals rest. But we have something that's worse than that. So when my doctor and I went to see him, I said, I am extremely fatigued. I used the word fatigue. I said, I'm exhausted. I'm exhausted all the time. Exhaustion. I was using that word to make sure he understood it wasn't that I was tired. I even went to being lethargic. I said, I'm lethargic all the time with this lethargy, whatever it is. I use the word lethargic, and I use all of them together and never the word tired. Not extremely tired, not I'm tired all the time. Nope. I said I'm exhausted. Now, in the video, I might have said the word tired because I'm talking to you all, and I may say it in the video because, I want to make sure that I don't have to use the word exhausted 500 times or fatigue, but they'll be interchangeable. But I just want to make sure that when you're talking to your doctor, you're not using that word, because those three things, the exhaustion, fatigue, or, being lethargic, could mean something else. And so if you're not getting their attention by them telling you that you're tired, make sure that you use those other things, because you may get their attention and make it easier for you to explain to them that you believe that you have cancer-related fatigue. Now, I didn't know that this was a thing. I didn't know that that's what the name of it was. So when you go in, you tell them that you believe you have CFR. because there's a name for it. We may not even have to go in there and tell them we're fatigued and I'm exhausted. You might just tell them, look, doctor, I believe that I have CFR. And then explain to them that men who have prostate cancer are more likely to end up with that. I mean, think about it from the hormone side, right? We have low testosterone levels. There's the ADT where they're lowering your testosterone level. And those things is what us men use for energy, for kind of building our muscles and things. So we can have a low T level. Now, I understand that when that whole thing, there's different ways that doctors look at it. My doctor did not want to increase my testosterone level right after or for some time after. But there are some doctors and some people who are getting TRT or the testosterone replacement therapy, and it's working for them. I'm not telling you which one is right. I'm just saying that in terms of what it is that I did, my doctor gave me a plan and I went with that. But having that low testosterone level was tough. It was tough. Now, I ended up losing some weight and actually working out and walking, and some of those things, and my testosterone level ended up going back up. And I realized that there were different types of testosterone, a lot of stuff that my doctor and I had a conversation about. He had explained to me that, my good testosterone level and the way that they were looking at it, that was fine. So my energy was up. But again, CFR, sometimes it's sudden. There could be a sudden drop of energy. In some cases, it used to be that I was walking around, out of nowhere, just extreme fatigue. I mean, I can't explain it to any of you who may not have been diagnosed, but for those of you who have been diagnosed and may already be into your treatment, you know exactly what I'm talking about. I think extreme is not even the word I'm looking for, because that's how much of a wrench it throws in my doggone day. Sometimes it makes regular activities very, very difficult. In some cases, I wasn't able to do them at all. Recently, I decided that after 2 years and taking, the medication and the things that my doctor had given me, I was like, you know what, let me see. And I had done it before, but I was like, let me see again. I'm over 2 years now. Maybe I'm not as tired. Sure enough, I was right back to that. Now, it wasn't quite as bad, but for me, I don't know. I'm just going to assume that this is something I'm going to have to live with as I continue in my recovery. But you got to think. Your mental health, gentlemen. Psychologically, you're going through so many things. You've been diagnosed, wasn't expecting it. Then you are changing. And then for me, I felt like somebody had taken something from me. I just felt like once I had my radical prostatectomy, like somebody had taken something from me. And I know that it was the surgery and the low testosterone level. I mean, I just didn't feel like myself. And so when you go through those things, mentally, that's going to beat you up. Causes stress. Could cause you to be tired. Make sure you're keeping that in check. Make sure that you are minding your mind, or looking out for and making sure that you're having something that is allowing you to mentally not necessarily stay in that rabbit hole with that issue. Make sure you're eating right. I told you nutritionally, I take all of these, I take supplements and stuff, but I went through a bout of the fruit smoothies. I buy the fruit in the bag, and then only thing I put in mine is the fruit in the bag. I make sure that some cherries are in there. So I get the mixed fruit and the cherries, and the only thing I put in there, pineapple juice. That's it. Pineapple juice and spin it. And I like it. It tastes good. I make sure that the one has peaches and stuff in there. But those fruit with the pineapple and the mango, and it's sweet. It tastes good. I drink it in the morning. Awesome. I actually drink it before I go to bed as well. Make sure you are getting nutrition in, because you're not going to always feel like you want to eat. Heck, I didn't feel like I always wanted to eat. So you got to do all of these things. And I'm saying this to you for a reason. It's because if you just let it ride, one of the indicators that, this may have metastasized, may have been coming back, is that all of a sudden you may start getting tired. So maybe you weren't going through this at all. So that's why I want you to make sure you go get checked. It's just a visit, gentlemen. It's just a talk. And that's just a talk to hold them accountable for making sure that they come up with something. Go home and get rest. Go home and get sleep. Nope. You tell them it's CFR. You explain to them why you think it is. And then make them tell you that it's not and why. And if it doesn't work for you, find somebody else to talk to. Because again, we're more likely to have it because the things that we have are actually energy-related things that are being knocked down. So you're going to be tired, more so than what other people would be. So keep that in mind. Just keep that in mind. I want to make sure that you all are going to the doctor, just making sure that you are staying on course and that your energy level is where it needs to be for your recovery, because that's very important. The more you start to feel like yourself, the more you'll pull yourself through, and the more you'll have that available on those bad days to get you through. Hey, I hope this helps. I hope this finds you well. Peace and blessings, fellas.